Hello everyone, it's Dr. Locklear and I'm coming to you with Exemplar 48B, Individual Information at Point of Care. So this is where we are going to be talking about, giving that direct nursing care to our assigned clients. We're going to summarize the advantages of point of care services and outline uses of computer-based patient records in community and hospital settings. So what is nursing informatics? It's understanding the intersection of science and technology. So again, we've talked a lot about with the informatics pieces, and the concept of informatics, of how it is used and how useful it is in healthcare. So what is our overview? Some studies have proven that the more direct nursing care a patient receives, the better the quality and safety of care that is delivered, and the more satisfied both nurse and patient are with the care. Nurses have reported that charting is an activity that consumes much of their time and takes time away from the bedside. And remember, we do chart every 2 hours. The ability to enter data into a patient's chart while at the patient's bedside seems like a valid compromise. Most of your electronic health records allow recording of vital signs, medication documentation, assessment notes, and responses to nursing interventions. One of the selling points of the electronic health record is that charting at point of care is possible and that it helps to increase efficiency. Interventions at point of care refers to the interventions or testing that takes place using transportable, portable, or handheld devices near the patient. This setup provides on-the-spot information about the patient rather than having to wait for the results from blood, or urine samples sent to the lab. So in other words, nurses feel like charting consumes them, so the electronic health record was supposed to make it easier because it's right there at the bedside and you can chart before you even go out of the patient's room and go ahead and chart while it's still fresh on your mind. So nurses seem to be more satisfied. A lot of nurses really, really like using the computers and charting. As soon as, the events happen, they can chart in real time, but sometimes that's not always feasible. You may be having an extremely busy day and your patients have all kind of issues and you may not get the chart later, so you have to go back and catch up your charting. But you can do that in the health record. You can change the time and go back and do your every 2 hours, but the ideal is to do it every 2 hours. Computer-based patient records, as you see here, face-to-face versus online communication. So again, the electronic health record's not meant to take away from face-to-face. So, you have to learn how to talk to patients, talk with physicians, talk with people on the interdisciplinary care team, and talk in a way that's clear, concise, factual information that everybody can understand. Everything that we do is not always carried out by reading it on the computer. We still do have face-to-face conversations. We must not lose sight of the human element. And it gives you an example here in your chapter. An acute change in the patient condition still requires a phone call to the physician. News of a pathology report that indicate cancer should be called to the physician right then. You shouldn't wait. You still need to talk to people. You're not going to rely on the computer for everything. So for patient monitoring and computerized diagnostics, many facilities use systems that allow electronic transmission of information from monitoring equipment like checking your finger stick blood sugar, or putting in labs, or the vital sign machine, or the IV pump. We are seeing more and more of that. X-ray departments can just load things right in to the system, just pretty much all throughout the hospital. And here's a list for you: lab results, radiology, and documentation in the medical record. Community and home care, You want to incorporate evidence-based practice guidelines into the electronic health record system so you can improve quality of care. More than 4 million people are admitted to or reside in nursing homes and skilled nursing facilities. Another 1 million reside in assisted living, and nearly 5 million patients receive some degree of home health. Nurses are the main providers. The physicians rarely go out and see patients at home. It's usually nurses and nursing assistants, or PT or OT will go out to the home. It is difficult sometimes to stay current with the management of complex medical issues that home health nurses are facing. The incorporation of current evidence-based clinical practice guidelines into the system helps them, so they can go into the system and read, what's best practice while they're in the home health setting. And you will use a computer a lot if you are a home health nurse. Case managers. I was a case manager for 2.5 years when I worked at the hospital in Lumberton, and I thoroughly enjoyed that job because I got to go to different units, and I did a lot of discharge planning throughout the day, every day. And so with the electronic health records, it helps manage the care of certain patient populations, especially those with chronic medical conditions, diabetes, acute conditions, joint replacement, psychiatric disorders. It assists the case manager by allowing trending of patient progress, documentation, patient education, and observation of quality metrics, which are those things that you measure, those surveys. That's what I was talking about, quality metrics. It also allows improved coordination of care because the case manager has to coordinate discharge planning with the physician to get the patient out of the hospital as quickly as possible. And so they have access to all this information in the medical record. The doctor can go in and read and see where the patient needs this or that if they don't get to talk to them. Patient education, information on health conditions and procedures. We've already said that. It can be printed out, reviewed with the patient and family, so you can print out this educational material. Standardized material regardless of the settings. So standardized care plans, standardized educational documentation. Maybe it's a person with hypertension or diabetes. It can be printed or linked to different languages, and you can, if you're a home health nurse, you can pull these up on your computer screen in the home. The nurse must ensure that the material is accurate and it is evidence-based. Be careful going outside the realm of the electronic health record to look for resources. Look in what the facility has built in first to get your educational pieces instead of doing a Google search. Review the material with the patient and family in person. You have to give them this educational material face to face. Again, like I said, some folks have done a computer in the room and showing them a video. Maybe you're teaching a breastfeeding class or a Lamaze class, and you want to show them how it's done.